Hi and welcome to True Crime, a channel dedicated to the dark underworld of criminal activity carried out by gangsters, mobsters, cartel leaders, and others. In this video, we will be discussing the life and crimes of one of the most notorious serial killers in British history. Dr. Harold Shipman was a trusted family doctor who took advantage of his position of authority to murder his patients. Let's get started. Number 1. Harold Shipman. Who was he? After graduating from Leeds School of Medicine, British serial killer Harold Shipman started his career as a doctor in 1970. He administered deadly amounts of opioids to his patients between that time and the time of his arrest in 1998, resulting in the deaths of at least 215 and maybe as many as 260 of them. Number 2. Early life. Harold Frederick Shipman, who went by Fred, was born on January 14, 1946, in a working-class family. He was the second child, and his mother, Vera, favored him over his siblings, instilling a sense of superiority in him at an early age. This resulted in him becoming a solitary teenager with few friends. When his mother was diagnosed with terminal lung cancer, Shipman was fascinated by the positive effects of morphine on her suffering and oversaw her care until she passed away on June 21, 1963. Her death had a profound effect on him, and he became determined to attend medical school. Despite failing his entrance exams the first time, he was eventually admitted to Leeds University Medical School and completed his hospital internship. At the age of 19, Shipman met his future wife, Primrose, who was 17 years old and 5 months pregnant with their first child. Despite their young age and circumstances, they got married. In 1974, Shipman had 2 children and joined a medical practice in Todmorden, Yorkshire. He initially thrived as a family practitioner, but allegedly became addicted to the painkiller pethidine. He was caught forging prescriptions for large amounts of the drug and was forced to leave the practice in 1975. He entered a drug rehabilitation program and received a small fine and a conviction for forgery as a result of the subsequent inquiry. After a few years, Shipman was accepted onto the staff at Donnybrook Medical Center in Hyde. He quickly ingratiated himself as a hardworking doctor who was trusted by both patients and colleagues. However, he was reportedly viewed as arrogant by junior staff members. Despite this, he remained on staff at Donnybrook for almost 20 years, and his behavior only incurred minor interest from other healthcare professionals. Number 3. Crime. Dr. Shipman's patients were dying at an unusual rate, and the local undertaker was the first to notice. He observed that they all died in similar positions, usually fully clothed and sitting up or lying on a settee. He spoke to Shipman about his concerns, but the doctor assured him that there was nothing to worry about. Dr. Susan Booth also noticed the similarity and alerted the local coroner's office, which contacted the police. An investigation followed, but it did not yield any evidence of foul play as Shipman's records appeared to be in order. Unfortunately, the inquiry did not contact the General Medical Council or check criminal records, which would have revealed Shipman's previous conviction for forgery. A more thorough investigation later revealed that Shipman had altered the medical records of his patients to match their causes of death. Shipman's killing spree went on undetected for a long time because he hid behind his image as a caring family doctor. It is unclear when he started killing his patients, and it is difficult to determine the exact number of victims he claimed. His refusal to acknowledge the charges made it even harder for authorities to bring him to justice. It was only when Angela Woodruff, the daughter of one of his victims, refused to accept the explanation given for her mother's death that his crimes were finally exposed. In 1998, Shipman visited Kathleen Grundy, an 81-year-old widow, who was active and wealthy. A few days later, she was found dead in her home. Shipman advised Woodruff, who was Grundy's daughter, that an autopsy was not necessary and Grundy was buried as per her daughter's wishes. However, Woodruff was surprised to discover another will that left most of her mother's estate to Shipman. She believed that the document was forged and that Shipman had murdered her mother to benefit from her death. Woodruff informed the local police, and Detective Superintendent Bernard Postles quickly came to the same conclusion upon examining the evidence. Grundy's body was exhumed, and a post-mortem revealed that she had died of a morphine overdose, which was administered within 3 hours of her death, around the same time Shipman had visited her. Shipman's home was searched, and medical records, an unusual collection of jewelry, and an old typewriter that was used to create Grundy's forged will were found. Police realized that the case was much larger than one death, and they prioritized those cases that were most likely to lead to further investigation. They focused on victims who had not been cremated and had died following a home visit by Shipman. In many cases, Shipman had urged families to cremate their loved ones, stating that no further investigation was necessary. However, in cases where families raised questions, he provided computerized medical notes to corroborate his cause of death pronouncements. Number 4. The trial and aftermath. Later, it was discovered by police that Shipman would, in most cases, change these medical records as soon as the patient was killed to make sure that his version of events matched the past data. Shipman had not realized that the computer would timestamp each change made to the documents, allowing the police to identify precisely which records had been changed. The police charged Shipman on September 7, 1998 with 15 separate counts of murder as well as 1 count of forgery following intensive investigations that included many exhumations and autopsies. On October 5, 1999, Shipman's trial got underway at Preston Crown Court. The Grundy case, as well as to have damning evidence relating to Shipman's fraudulent accumulation of morphine and other drugs be admitted into evidence, were all rejected by the court, and the trial moved forward on the 16 charges listed in the indictment. The prosecution rejected any allegations that Shipman had been acting humanely because none of the 15 patients were suffering from a terminal disease, and said that he had killed them because he relished having control over life and death. Woodruff showed up as the initial eyewitness. The jury was struck by her candor and depiction of her unwavering commitment to finding the truth, and efforts by Shipman's defense to discredit her mostly failed. The government pathologist then guided the court through the horrifying post-mortem results, which revealed that morphine intoxication was typically the cause of death. Afterward, a fingerprint examination of the faked will revealed that Grundy had never handled it, and a handwriting expert disregarded her signature as a shoddy forgery. Next, a police computer analyst testified about how Shipman had changed his computer records to manufacture symptoms that his deceased patients had never had, frequently just hours after they had passed away. The conducting pattern of Shipman became even more obvious when the trial moved on to other victims and the testimonies of their relatives. A second scam was revealed. He would pretend to call the emergency services in front of family members, then cancel the call after the patient was found to be dead. Lack of sympathy, contempt for the requests of accompanying relatives, and a refusal to try to revive patients were bad enough. No actual calls were made, according to phone records. Last but not least, evidence of his drug hoarding was presented. This included false prescriptions for patients who didn't need morphine, excessive prescriptions for others who did, and documentation of his visits to the homes of recently deceased people to gather up unused drug supplies for disposal. Shipman's arrogant behavior during the trial did little to help his defense present a picture of a committed healthcare provider. Despite their best efforts, the jurors had no affection for him because of his haughtiness and penchant for switching accounts when he was exposed for telling blatant lies. The jury was sufficiently persuaded by the testimony and evidence presented after. The judge gave a thorough summary of the case and warned the jury that no one had seen Shipman kill any of his patients. On the afternoon of January 31, 2000, the jury unanimously found Shipman guilty on all counts, 15 counts of murder and 1 count of forgery. The judge sentenced 15 people to life in prison as well as 1 person to 4 years in prison for forgery, which the judge later changed to a whole life sentence, essentially eliminating any chance of release. At Durham Prison, Shipman was a prisoner. The fact that a doctor had killed 15 people sent shivers through the medical profession, but this was to be unimportant in light of follow-up inquiries that probed more deeply into his patient case list history. Professor Richard Baker of the University of Leicester conducted a clinical audit in which he compared the number and distribution of deaths in Shipman's practice to those in the practices of other doctors. It was shown that Shipman's senior patients had significantly higher death rates, which tended to cluster at specific times of the day. It was also discovered that Shipman attended an unjustifiably high proportion of these instances. He may have contributed to at least 236 patient fatalities during 24 years, according to the audit's estimates. A separate inquiry commission, led by High Court Judge Dame Janet Smith, reviewed the records of 500 patients who passed away while under Shipman's care, and its 2,000-page report found that it was likely that at least 218 of them had been murdered. However, Dame Janet offered this number as an estimate rather than a precise calculation because some cases lacked sufficient evidence to permit certainty. The report also suggested that Shipman might have been addicted to murdering and criticized police investigation practices, asserting that the lack of expertise of the investigating officers led to missed opportunities to bring Shipman to justice sooner. Shipman's medical career may have begun with the death of his first victim, 67-year-old Margaret Thompson, who passed away in March 1971 while recovering from a stroke. However, any deaths that occurred before 1975 were never officially proven. Regardless of the exact number, Shipman's killing spree made him not just a British patient killer, but the most prolific serial killer known to date. He remained incarcerated in Durham prison throughout the investigations, always denying any wrongdoing, and was staunchly supported by his wife and family. He was later transferred to Wakefield Prison in June 2003, making it easier for his family to visit him. On January 13, 2004, Shipman was found hanging in his cell, having used bed sheets tied to the window bars. The whereabouts of his remains remain uncertain, with some speculating that his body is still in a Sheffield morgue, while others believe that his family has custody of his body and is awaiting further testing due to suspicions that he was murdered in his cell. Thank you for watching another amazing video from our true crime team. Like, comment, and subscribe. And stay tuned to our next real-life true crime video.